Have you ever felt dizzy when you were standing up, or you felt dizzy when you were lying down, or maybe you felt dizzy when you got headaches or when you turned your head a certain way? Many of you I know have had or have dizziness, and I know this because you've written me asking me to do a video on dizziness. I'm going to be very honest with you right now, guys. It's taken me a long time to do this video because honestly, dizziness is one of the broadest topics, meaning the causes of dizziness can be literally so many things. And sometimes it can be tricky to figure out what the cause is, but I'm going to do my best. Guys, I'm Dr. Caudle, practicing family physician, on-air health expert, and video creator. Okay, this is what we're going to do today. I'm going to organize myself and organize y'all. I'm going to talk to you about some of the main causes of dizziness, but more importantly, I'm going to tell you exactly what you need to do when you visit your doctor to talk about your symptoms. Because, by the way, how you tell your doctor about what's going on and the dizziness you have is honestly a big part of whether they're going to be able to diagnose you, period, or diagnose you appropriately or correctly, okay? So let's just go ahead and get started. First of all, any emergency symptoms, any symptoms of dizziness associated or not associated with anything else that you are worried about, you seek emergency care ASAP. Don't watch this video and say, oh, Dr. Jen just told me to, Dr. Jen didn't tell you. No, 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 no. If you have an emergency, you seek emergency care right away, okay? Now, let's talk about why dizziness can be so overwhelming for the doctor as well as the patient. Well, first of all, dizziness can be caused by a number of different sort of systems in the body. You could be dizzy because of issues with your heart. You could be dizzy because of issues with your inner ear. You could be dizzy because of issues with your brain or issues with your sort of neurological system. You could be dizzy because of medications or behaviors. Oh, and the list goes on and on. So I'm going to tell you now some of the main causes of dizziness that we have, that I see in the office, but more specifically what you need to do when you go to the office, because it's not an emergency, right? Because if it's emergency, y'all know to go to the ER or to seek emergency care. When you're talking to your doctor about your dizziness, I need you to be so specific. I mean, I need you to have pencil and paper and be writing down your symptoms. The other reason why it's so hard to figure out dizziness is because honestly, what dizziness means to you or me could be completely different things. So remember, when we talk about dizziness, some people are actually really talking about vertigo, which is a sense of the room spinning or the person spinning. Or they may be talking about pre-syncope, which is this idea of almost feeling like you're going to pass out. Some people are actually talking about what we call disequilibrium, which is feeling unbalanced or unsteady. And some people are really referring to lightheadedness, which feels like, you're feeling like you're floating and you're sort of like woozy and just sort of in a whole different place. All of those things tend to fall under the category of dizziness. So let's talk about what you need to do and talk to your doctor about when you go to see them about your dizziness. First of all, you need a pencil and a paper because you need to document your symptoms very specifically. First thing is, think about, what is it you actually feel? Don't just say you feel dizzy. Is it that the room is spinning? Is it that you feel like you're going to pass out? Is it that you feel unbalanced or unsteady, like you're going to fall? Or is it that you just feel woozy and like, woo, like floating, kind of like disconnected, okay? Then we're going to talk about the associated symptoms. This is also what I need you to write down. Meaning, with the sensation that you have, okay, I'm going to call it dizziness just for, ease. What else is going on? Okay, so now let's get to the nitty-gritty. Number one, an example is BPPV, or benign paroxysmal positional vertigo. This is a very common form or cause of dizziness, even vertigo, actually. And what people get with this is they get dizziness, okay, vertigo, when they turn their head. So you want to think about what's happening to me, what else is going on when I get dizzy. But that's one example. Another example is that people can often get dizzy when they become anxious. Are you worked up, excited, anxious, nervous, sad, scared? Is it associated with an emotional component? You see what I mean? Another cause is a heart arrhythmia. Sometimes one of the ways I diagnose atrial fibrillation or a heart block or other heart issues is people will say, I feel dizzy, I feel like kind of out of it, but my heart also is racing, or I feel short of breath along with it. And sometimes it's the shortness of breath symptom or the heart feeling funny or sounding or beating funny that tips me off that, oh, maybe it's not the inner ear, maybe it's not the head moving and, blah, 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 or whatever. Maybe it's the heart. You see what I mean? Let's keep going. What if you said to me, Doc, I feel dizzy when, I haven't eaten yet, but when I eat something, I feel better. Well, maybe for you, it's low blood sugar. Or you say, oh gosh, I feel so dizzy or lightheaded around my period time. Well, I'm going to ask you, do you have heavy periods? Because maybe you're anemic. That's exacerbated low blood counts when you have your period. I'm trying to give you examples of why these sort of symptoms matter. I thought this was a better way to approach this than just telling you the causes of dizziness. Because what I need from you, when you come in to see us, when you see me as a family doctor or any of my colleagues, I need you to be specific. You feel dizzy, lightheaded, like you're going to pass out, any of those symptoms when this or that happens or when this is going on. Let me give you some other examples, okay? Do you also experience hearing loss and buzzing or ringing in the ears? Because if you do, when you're, dizzy or feeling vertiginous or like vertigo, you may have something called Meniere's disease. That's sort of an inner ear thing. Also, do you feel dizzy, but you also have these sort of gait problems? You're tripping or falling, or you're leaning to the side. Maybe it's something going on in your brain, okay? A brain issue, brain tumor, something else. Not just brain tumors. I'm not here to scare you, but there's a lot of things that can be normal pressure hydrocephalus. There's a number of things, okay? Does your dizziness come with headaches? Because that actually could be a vertiginous migraine. There are forms of migraine that actually have vertigo or sort of dizziness components with them that patients feel. Also, would you say to me, and I've had many patients say this, oh, you know what, I feel really dizzy after I take my meds, like an hour or two afterwards. First thing I'm going to go to is look at your med list and see, what are you taking? There are plenty of medications that can actually cause us to feel dizziness, lightheadedness, feel like we're going to pass out, and maybe your medications need to be changed, switched up, altered, okay, adjusted, all right? That's important. There's also, of course, common things that I know you've thought about, things like a TIA, it's like a transient ischemic attack, or a CVA, which is a stroke. Obviously, there are things like that, but there are also things like, a eustachian tube dysfunction issue. Let's say you feel kind of dizzy, but you also feel like your ear is clogged. Maybe you have an issue with your eustachian tube, okay? Maybe if you have something like dizziness, but you also have double vision, it could be something like MS or multiple sclerosis. It could be carotid stenosis. That's also sort of a blockage of the carotid arteries. If I know that you've got vascular disease, I may be looking into this. The point of this video is not to have you figure out why you're dizzy, because the truth is you may not be able to figure it out. And that's not, again, the point of this. The purpose of this video is to tell you why it's so important for you to understand and document your symptoms very carefully, because every single one of the symptoms you have, along with the dizziness, is going to help me and my colleagues help figure out what's going on with you. Remember, dizziness can be caused by so many things, from the inner ear to the heart, to even the lungs. Look, if your breathing is not correct, if your breathing ain't right, you may feel dizzy and lightheaded, okay? That could actually happen, which is why we need to know this, okay? Do you feel dizzy after you exert yourself, after climbing stairs or what have you? So once again, back to what I was saying, it can be the inner ear, it could be the heart, it could be the brain, it could be the lungs, it could be your medications, it could be so many other things. So when you go to your doctor, because you'll go to them only when it's not an emergency, but when you go to your doctor to talk about dizziness, think about exactly what's going on. Write down your symptoms. Keep track of them. Keep what we call a symptom diary. The time of day, when it happens, when it's worse, when it's better, what you do when it happens, what just happened before, what has happened afterwards, any other unusual signs or symptoms that you have noticed. Anything at all, whether you think it matters or not. Sometimes even seasonal allergies cause people to feel dizzy. So you understand what I'm saying? And this is why when somebody comes into my office saying, Doc, I'm dizzy, I say, okay, let's get started. And I ask a million questions because I need to get those answers. I need answers to almost a million questions sometimes to figure it out. Now, sometimes it's very obvious, okay? Once again, if it's an emergency, you go to the emergency room right away. You do not wait for that. But guys, I hope this is helpful. I know this is a little bit of a non-traditional video than what I do. You know, I'm not usually telling you what to talk to your doctor about, but I felt like this was the best and most appropriate way to tell you how to approach dizziness and give you examples of some of the things it could be. There are many other things that could be causing your dizziness. I just scratched the surface, which is why you keeping documentation and a symptom diary of your symptoms is literally the most important thing you could do. Guys, I hope this is helpful. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. For those of you on Facebook, thank you for the stars. I will respond to you personally. Let me know if this video was helpful. I hope I did this right because I was a little nervous about this. I've been thinking about it for weeks. If you've not liked and followed my page, please do. Consider joining my subscription groups as well for exclusive content. For those of you on YouTube, hello, I see you all. Please subscribe to my channel and click the little bell for updates, guys. I'm Dr. Jen. I'll see you soon.